It is a real pleasure to be with you. I want to thank Ann Reel as well for the extraordinary job that she and her organization and IR have done in bringing us all together today. You couldn't have picked a more appropriate time to have this conference, and I'm very appreciative of the opportunity to be with you to talk about health care and health reform as we look to the legislative agenda for the rest of this year. When Ed introduced me, I always listen carefully because in politics, you get introduced in so many ways. I remember vividly the time a few months ago I was introduced as a model politician and a model United States Senator, a model congressman, a model South Dakotan, just a model guy all the way around. My wife Linda showed me the word model later on that night as it's defined in the dictionary, and there it's defined as a small replica of the real thing. So I really appreciated the fact that Ed chose not to use that word as he described me this morning. And the other thing that happens as you travel the country and you have experiences like I had in Atlanta a few weeks ago. I was checking my luggage at the airport, and somebody behind me in line was staring and it was quite obvious he was staring at me. And he finally looked at me and got my attention. He said, anybody ever tell you look a lot like Tom Daschle? I said, yeah, people have said that. He said, doesn't that make you mad? So I hope I can get through this without making you mad. I want to commend you, first of all, because I know that a lot of you care passionately about what it is you do. Ed and I had a brief conversation before the program started, and I could feel his passion. I could feel the dedication that he has to his work, and I know that each of you have to yours. And so I think it's oftentimes misstated or misrepresented that somehow this is all about money. This is about saving lives. This is about improving the quality of life. This is about making people better, healthier. And all of you contribute in all kinds of ways to that goal. And for that, I think many of us who are the beneficiaries ought to express our sincere gratitude for how well you do it. In politics, you get the opportunity to meet people from all walks of life. I've met just about everybody, it seems. Some people have had greater impact on me than others, but in every case, those meetings have been very memorable. I remember walking down the halls of Congress one night, maybe 10 or 15 years ago now, with John F. Kennedy's speechwriter, whose name is Ted Sorensen. I don't know if you know the name, but he's a fantastic speechwriter, arguably one of the best in all of history. And I've come to admire him a great deal. He's actually a Nebraskan. He wrote an autobiography a couple of years ago that I would recommend to any of you. But as we were walking down the hall, the Senate had shut down, and if you walk the marble halls with all of those statues and the lights are turned low, and you hear your steps reverberating in that marble, and you hear the soft, quiet, muffled sounds of people maybe 200 or 300 yards away because it's so quiet. As we were walking down the hall, he said, you know, Senator Daschle, I don't know if you realize it, but every day in ways large and small in this building, referring to the Capitol, you make history. Every day. Yesterday, history was made. I'll talk about this in just a few minutes, but today, history is being made in the United States Congress in a profound way. Sometimes when the challenges of our country coincide with extraordinary leadership, you have what we call transformational moments in history. Transformational moments are these huge events that change the course and direction of our country, oftentimes forever. In 1907, we had the financial panic that up until then was by far the single biggest economic crisis our country had faced. That great financial panic led to the creation of our monetary system and the Federal Reserve Board, something that is with us yet today. From 1929 to 1933, we went through a Great Depression. And it was through that Great Depression that another transformational moment was created where, in many cases, we changed the role of government in society today, creating the Social Security system and many others. In the 1960s, in large measure because of the extraordinary confrontation and anxiety created between minorities and non-minorities in this country, civil rights legislation was passed that today we take for granted. But it was so transformational that we ended this segregation that had been part of our fabric in society for 200 years. And who can forget 9/11? And the impact, the transformational moment that represented to this country and to us even today, 8 years later. My point in raising all of this is actually to suggest, and this goes to something Ed said at the beginning, we actually could be in a transformational moment with regard to the design of our healthcare system in this country today. It's not an exaggeration. We actually could be transforming almost 20% of our economy and society at large by what the Congress decides to do now. And it doesn't need to be emphasized to this group that you, perhaps more than anyone else, could be very, very profoundly affected. Well, we'll know in the next 4 months, likely, how transformational this is. There are things we know. We know that we have serious and undeniable problems in our healthcare system today. We know we have a president who has made the decision to commit to addressing those problems in a comprehensive way and decided to make that a high priority within his administration and agenda. We saw that as late as last Sunday in an unprecedented demonstration of his determination to ensure people understand what it is he wants to do. Never have we seen a president do 5 live television interviews all on one Sunday morning, nor speak to a joint session of Congress as he did about 10 days ago. So all of this means that there could be profound repercussions for this industry and for you, and I am very impressed that a room full of professionals would take time away from your busy schedules and days to come to better understand the implications for each of us.